if you haven't seen part 1, go to part 1. Ow, I hurt my nail. I ain't even hardly got a nail because I ripped it off with the fake crap I put on there. Anyway, so this is just medical stuff. I think I stopped at the part about going to hospitals and drug seeking and all that good stuff. Anyway, so my cardiologist gave me a note last year because, in fact, just recently, the last time I went to the ER, I had, not the last time, time before, I had to deal with a doctor that I've known for years. And I had a talk with him, and he made me feel like a piece of dog poop because I was there, because I was hurting. Anyway, last year, my cardiologist, Dr. K, I call him Dr. K because his name is 20 miles long, and I can't say it. So everybody calls him Dr. K. Anyway, he gave me a note that says, basically, that I keep with my med list, that says if I'm seen in the ER, any ER, if I am seen in any ER presenting chest pain, to call his office. Has his office number and then his signature. Well, I lost that a couple ER visits ago because they always ask me, although it's in the computer and it doesn't change that much, and small changes in my medication I can remember, so I don't need to show them the list, but they always ask for the list and I always give them that note. Apparently a nurse did not give it back, so I had to get another copy from the office yesterday, which he said that's not a problem because it's in my file. But anyway, God, not my eggs. My eggs just fell over. They're fine, I'm sure, hopefully. Anyway, Sarah and me both going through an egg phase. But anyway, so, but anyway, he was talking about how, we were talking about how unique my medical history is, because he said even when he met me last July, he honestly had, I was in the hospital 4 days, and he ran every single test imaginable, heart cath, an echo, just everything. And then also got verification from my PCP, the specialists that I used to have that no longer take my insurance, to get verification and medical records concerning diagnosis that I had received from them and treatment and stuff. So, proof, basically. I mean, every doctor is going to ask for, you know, you can't say, hey, I was diagnosed with MS, which I was last year, and not have medical records of that diagnosis. But anyway, I mean, they're going to ask for it, especially if you're on medications for it. So, I mean, I guess anybody can say, hey, I've got this, I've got that, and not have it. I'm going to finish this up, hopefully quickly. I'm sorry, I like to blab. But anyway, so, hope Sarah's in there doing the dishes, because that's what she was told to do. She's being a pain today. Anyway, so he said when he first met me, he honestly couldn't believe my medical history until he got all the paperwork and then physically saw my heart. Not physically, I didn't have open heart because of him. Or he didn't do the open heart surgery or anything, but he did the heart cath and all this stuff. He is one of the, I've never had a doctor that I can remember that was so straightforward, like, you have to do this or this is going to happen, but so human about it. I mean, it's like he doesn't elevate himself. I've had plenty of doctors. In fact, one doctor years ago, I told him, I may be your patient, but I'm not a piece of shit. Quit talking to me like I am. And then he actually said, I mean, I'm just, you know, I don't know word for word now, it's been years, but he said something to the effect of, thank you for bringing that to my attention, because sometimes we disconnect from what we're doing. And it's really sad that doctors do that. They see people as, you know, chart number, you know, 271, not Wendy Oliva, which is who I am. I've got a name, you know, and I'm a person. I'm not just, you know, a chart. But anyway, so we were talking yesterday about how complicated Some things are serious. Some things aren't. Some things could shorten my life if not treated, which I'm treating everything, especially my heart. I only got one heart. Hello. But he said he was just amazed, and every single thing that I said I had on that piece of paper, because I keep everything on a piece of paper, I have, you know. And he said, to a medical student, I'm like a dream come true, because they could study me and learn everything, which is really pathetic. And that's where my emotional side takes over, and it's like, I'm glad these things have been found out about me, because without treatment, the way, especially years ago with the very first, when I was diagnosed with cardiomyopathy, it was back then, it was called IHSS, which is idiopathic hypertrophic subaortic stenosis. And then it was renamed hypertrophic cardiomyopathy. I have hypo, and there's hyper and hypo, depending on where the thickness is in the heart. Anyway, the way my life was going then, with past drug use and the way I was living in my very early 20s, I very well could have killed myself. Well, anybody can kill themselves. But my heart needs the workload softened, lessened, I guess would be the word. And that's why I'm on a beta blocker and a calcium blocker. It makes my heart not work so hard, but it allows it to work enough to work, you know. But let's say I started doing meth, which back then it was not in my neck of the woods. It was not a popular thing. And it was mostly, I mean, I say drug use, and I smoked a lot of marijuana, and I don't really consider that a drug. Back then, of course, everybody, oh, drugs. Well, they still are, I guess, but, and other things. But if I would have done things that put a load on your heart, make your heart work faster, make your heart beat faster, make you speed, basically, I could have killed myself really easy, because I didn't know I had a diagnosis. So I'm thankful that I've gotten these diagnoses. I have gotten to the point over the years where I'm like, great, one more thing. It's shocking to me, but it's not shocking to me. So, but anyway, you know, he has told me, because even yesterday I said, you know, sometimes I worry this is going to, you know, all this stuff is going to shorten my life. And, you know, with medication and what they can do nowadays and what they are going to be able to do in the future and stuff, I should live just as long as anybody else, which makes me happy. Maybe not some other people, but, you know, to a medical student, he said, I'm like a dream, because, you know, I have everything. Just study my chart, look at me, and, you know, you can learn tons. But it's, I would much rather not have anything go on. I don't like having to take medication. I don't like having to deal with doctor's appointments. I don't like having to deal with different doctors constantly, especially when I say regular doctors, I mean not specialists, because specialists, not all of them, I've had specialists, you know, be assholes, and I'm like, okay, thank God I don't have to see them again. But you know, just doctors I know, doctors I don't know, especially in an ER situation, I hate it, because I have to explain over and over again what the pain's like, why my meds at home didn't work, because I have regular meds that a normal person would take, OTC meds, and then I have stronger meds. Well, I can't take nitro, which is one of the main things, and I can't take whatever, another medication that they prescribe or they give a lot in the ER. It works really, really well for pain. It's non-narcotic, or it's not like morphine or Stadol or Demerol or whatever, which I don't think I've ever been given Demerol for chest pain, but it just popped in my mind. But anyway, I can't take it. I have an allergy to it, as well as some, you know, anti-inflammatory drugs and other things. So sometimes doctors are like, tell me again why you can't take nitro. and I have to go through, I have cardiomyopathy, it exacerbates chest pain because of the thickening. I don't know. Google! You know? But anyway, it's depressing. I try to not let it get me down. I try to laugh about it most of the time because it's like, one more syndrome, leave it to me. But really, it's pathetic, and it really, really bothers me. And, but anyway, so I just wanted to get on here and just kind of do a medical blubbering vlog and whine a little bit, I guess. So I'm going to go in here. I got a few groceries I need to take in. I'm broke again, so I'm going to be lazy for the rest of the day, I think. We went to the park. It didn't work out. We left in 15 minutes. That's a whole other issue. But anyway, I love teenagers. All right. You guys have a wonderful day. God bless. If you watched both of these, part 1 and part 2, or any of them, I appreciate you sticking by me. All right. See y'all later. God bless. Take care. Bye-bye.